Decoding bronchial constriction and remodeling, the mechanism of chronic inflammation. Why do airways narrow permanently? Why is old air retained in the lungs?
Decoding smoking and alpha-1 antitrypsin deficiency. Decoding hypoxemia, low oxygen, and heart failure, the link. How do weak lungs overload the heart, also known as cor pulmonale?
Fine particulate matter. How do they penetrate deep and cause lung inflammation? The characteristic sound of wheezing. How is the sound created as air attempts to pass through narrowed airways? Decoding sleep and COPD status. How does sleep reduce protective reflexes and lower blood oxygen? Nocturnal hypoxemia. Dyspnea leads to a sedentary lifestyle, which leads to muscle loss, which leads to worse dyspnea.
Decoding osteoporosis and COPD, the link. How do systemic inflammation and corticosteroid use affect bone density?
Pursed lip breathing technique helps maintain positive pressure, preventing airway collapse and expelling old air.
Decoding overuse of bronchodilators. Why does excessive use cause hand tremors, tachycardia, and long-term reduced effectiveness?
So we're looking at a short, high-intensity training protocol for patients with chronic obstructive pulmonary disease.
Why can increasing oxygen too much lead to respiratory failure?
Cold, dry air causing sudden bronchial constriction.
Fluid and pus filling the alveoli, hindering gas exchange. Decoding the weakened immune gate. Smoking, stress, and sleep loss are reducing immune cells, macrophages, in the lungs. The role of deep sleep in producing cytokines and T cells. Decoding the habit of ignoring coughing and phlegm. The cough reflex is a self-cleaning mechanism. Decoding aspiration pneumonia, food or stomach fluid entering the lungs. Risk in the elderly or those with swallowing disorders.
Decoding aging and increased pneumonia risk. Reduced cough reflex, declining respiratory muscle strength, and immunity.
Overly thick phlegm obstructing clearance and blocking airways.
Decoding pneumonia and cardiovascular stress. Reduced oxygen and infection, increasing the burden on the heart. Lungs losing elasticity after inflammation. Puffing technique and positional drainage, helping to clear deep phlegm from the lungs. Drinking water, inhaling warm vapor, thinning phlegm, and soothing the respiratory tract.
Early pulmonary rehabilitation helps with your muscle and lung function.
Decoding self-stopping antibiotics. Why must the full course be finished, even when feeling better?
Chest percussion and vibration is a physical therapy mechanism for breaking up sticky phlegm.
Decoding risk of pneumonia recurrence. Why are the lungs still vulnerable after recovery?
Optimal sleeping position. 30 degrees.
Fine indoor dust particles also cause COPD. Interval walking training for COPD, boosting endurance without excessive oxygen desaturation.
Prolonged high cortisol suppressing the immune response.
Clean bedroom, reducing dust, pet dander, and mold. Lowering bronchial irritation.
Decoing the habit of self-medicating COPD with herbs.
Decoding incense smoke, cooking fumes, and lung damage. Fine indoor dust particles also cause COPD.
Experiment. Interval walking training for COPD, boosting endurance without excessive oxygen desaturation.
This abdominal fat compresses the diaphragm, which reduces lung volume and a person's ability to cough. Core strength training. Supporting the diaphragm and increasing coughing pressure. Warm shower, steam inhalation. Thinning phlegm and clearing the airways.
Uncleaned humidifiers can become breeding grounds for bacteria and mold.
Core strength training supports the diaphragm and increases coughing pressure. Nutrition rich in vitamin D helps boost lung immunity and reduce pneumonia risk.
Secondhand smoke can cause permanent lung damage in young children. Experiment oscillating PEP device, helping to break up and clear phlegm effectively.
Humidifiers can become breeding grounds for bacteria and mold. Nutrition rich in vitamin D boosts lung immunity, reducing pneumonia risk. Secondhand smoke can cause permanent lung damage in young children.
Experiment oscillating PEP device, helping to break up and clear phlegm effectively.
Secondhand smoke can cause permanent lung damage in young children.
This practice focuses on increasing your breathing volume and improving diaphragm usage.
Diuretic medications can cause hypokalemia, weakening respiratory muscles and affecting overall performance. Optional side sleeping. Optimizing posture for severe obstructive lung disease patients.
Decoding voice training in COPD, singing and speaking practice, boosting breath control and abdominal muscle strength.
DASH diet and respiration, lowering blood pressure, reducing cardiovascular strain for COPD patients.
Endurance training with a pulse oximeter.
Weight loss can have a significant impact on lung function, particularly an increase in total lung capacity. Viruses weakening the mucosa, creating conditions for bacterial attack. Increased fiber and lung health, the link between gut microbiota and lung inflammation. N-acetylcysteine, or NAC, works to break disulfide bonds in mucus, thinning phlegm and reducing oxidative stress.
Suppressing the cough reflex leads to mucus buildup and infection. Good posture standing straight, optimizing diaphragm activity and increasing lung capacity.
7 to 9 hours of sleep can lead to a reduced risk of COPD exacerbation.
A full stomach, putting pressure on the diaphragm. Optimal inhaler timing, before or after exercise, or before sleep. Viral pneumonia can cause severe inflammatory reactions in already damaged lungs. Sleeping with elevated knees can help reduce pulmonary edema due to heart failure.
And expand the chest.
Increased saline inhalation for COPD, moisturizing airways and aiding clearance.
Nicotine in e-cigarettes can cause lung inflammation, which may lead to irreversible lung damage.
Decoding the habit of eating and drinking quickly.
Reducing joint pressure, boosting respiration and endurance.
Decoding sleep deprivation and reduced swallowing ability. Optimal room temperature regulation. Maintaining warmth and stable humidity to avoid bronchial irritation.
Breathing with a comb or straw is a simple at-home positive expiratory pressure training.
Increased muscle mass, reducing the workload on your respiratory muscles.
Bellows breathing technique, improving lung elasticity and ventilation.
Decoding the habit of lying down watching TV all day. Reduced ventilation in the lower lungs and increased risk of fluid and bacteria buildup. Decoding fungal pneumonia. Mold and fungus in indoor and outdoor environments cause disease in immunocompromised individuals.
Chest stretches, increasing chest wall flexibility and lung volume.
Low sleep quality also reduces the capacity of your immune memory. Conscious sighing, recovering collapsed lung volume. Decoding the habit of eating cold food when ill.
Integrated relaxation therapy combines adequate sleep, light exercise, and deep breathing for lung recovery.